Hi there, Sandy Starr. Listen, I just wanted to share a slide with you and show you the difference between conventional and functional medicine. And then also invite you to check out our website. It's DM as in Del Mar, functionalmedicine.com. I partnered up with Dr. Kremer, who's an osteopathic physician who also practices integrative, regenerative, and functional medicine. And so it's a great blend to have a doctor-led functional medicine practice. And the reason why we got into functional medicine is because, through the years, we realized that we've got to get to the root cause of chronic health conditions. And with that being said, I'm going to go ahead and share the screen. Okay. And with that being said, there's a reason why we need to get away from just conventional medicine and have more of a projected view of our health down the road and make sure that we have that approach where we don't end up with disease and constantly trying to fix that. So conventional medicine is more disease oriented versus patient focused and preventative health care. And so when we talk about preventative, we talk about preventing disease, right? And so we look at lifestyle, we look at stress, we look at diet, the nutrition, the absorption. Are you actually absorbing the good nutrition you're taking in, or is your diet just crazy off? What's your body saying, right? Is it chronically inflamed? Do you have chronic disorders? Do you have metabolic conditions? Do you have extra weight on you? There's a lot of things that happen in the body when it becomes chronically inflamed. It starts screaming out skin conditions. People get eczema, rashes, GI disorders, things like that. And so we're really focused on preventative health care. And then the other one is doctor oriented, meaning you go to the doctor, they diagnose you, they write a prescription, you come back, they check the prescription, they might have to give you another one. That's just how they're trained and, to treat disease. And so what we do is we want to focus on the patient. We're patient centered, meaning we want to make sure the whole you is balanced. And we spend a lot of time on that. So there's a lot more time spent, a lot more detail that we go into, a whole kind of a timeline, to be honest, in the program we use. It's a timeline. We can see where those stressors happen. We can really see what's gone on in a lifetime that has caused these chronic conditions, because mindset plays a role as well. The other thing is, specialized doctors, right? You go to a GI doctor, you go to a foot doctor, you go to all these different doctors, and there's a reason. The body's very complex. And the other cool thing about this program and this functional medicine is that we, Dr. Kremer is an osteopathic physician. He can do regular MD stuff. He can be the primary care physician in our programs. And we do require you have one, because there's still important to have your annual physicals, your preventative, tests and things like that we normally do. But what we do is dive a lot deeper. And so we do more of a holistic approach, looking at the whole person. The other thing is we do, basic labs versus in-depth, comprehensive labs. This is a big part of functional medicine and our 6 or 12-month program, is that we run 3 labs. We look at hormones. We really look at cortisol, DHEA. We look for adrenal health. Where are you at with the adrenal? The stressors in your body. We do a GI panel. We really look in depth of what's going on with microbiome, gut balance, bacteria, digestion, leaky gut. We look for pathogens. There's a lot of things we look at that's really in depth, tells us a whole lot about what's going on. And then the other one's an organic acids test that looks at how your body's detoxing, how your body's actually, is it getting the nutrients it needs? Are there imbalances in there that we need to kind of realign, if you will, and look for those red flags and triggers? And then the other one is, addressing symptoms versus the root cause. The whole reason for functional medicine is we get to the root cause of chronic health conditions, chronic inflammation, anything that the body has been going through for a while. For me, it was migraines, to name one thing. I had autoimmune as well. which is in remission. Migraines are gone because I went to the root cause and addressed that. I got rid of the triggers. And that's what we do for our patients as well, so that you can be healthy, have energy, sleep well. And then the other thing too, medication versus nutraceuticals. And so medications have their place and they're very helpful in some ways, but they're not the answer. It's only a Band-Aid in a lot of cases and not meant to take long term. So we'll take cholesterol, a statin, for example, versus nutraceuticals, which are pharmaceutical grade supplements, are very, very high quality. And a lot of times I'll focus on a system. And so one of the things we prescribe would be like red yeast extract with CoQ10, for example, which is a natural statin. The CoQ10 protects the heart, because with statins, you can have damage to the heart muscle and you're deficient a lot of times in CoQ10 because it blocks that entire pathway. And so that's why we go to nutraceuticals usually first, because we really want to go naturally so the body can balance and not have anything take over. We want the body to do what it needs to do naturally. So hopefully that was helpful. We would love to see you check out our website. It's DM as in Delmar, functionalmedicine.com. I'll put it in the link below. And just get in touch. Would love to schedule a free call. It's a discovery call that I do just to be able to explain anything, go over anything, to see if it's actually a fit, because there are specific people that we're looking for to help. And one of it is a commitment for 6 months to a year, just to allow the body to do some healing and to get the right things in the system, the right balance. So yeah, would love to talk to you and give you a lot more insight on this, and hope to see you soon.